Do you want to be more productive at work? If you want to get more done on your to-do list, finish projects sooner, stay on top of your deadlines, and no longer feel behind, then you're in the right place and this video is going to help you. Today I'm sharing 5 productivity tools and how to use them to get the most effectiveness out of them so you can save time, get more done, and enjoy your life a bit more. Sounds good? Let's dive right in. Okay, but wait. First, welcome back. If you've watched my videos before, if you've subscribed, I'm so glad you're here. Another video to help you. But if you're new, hey, welcome to the community. My name's Marissa McCool. I'm the public health burnout coach. I've worked in public health 15 years, maybe longer. And one of my favorite things to coach on to help people with is productivity. I feel like since I hit burnout in 2017 and I hit it hard and I got out of burnout, I have become a master at productivity, at organization, at being effective. And one of my favorite things to do is share my tips, my insights, what works for me with all of you. Some of the tips I'm sharing with you today have helped me have a full-time job and run a business and work out 3 to 4 times a week and cook homemade meals and have date nights and hang out with friends and travel the world. And they can help you do the same. Now, I want to be clear. I'm not a special snowflake. I'm able to do these things because I implement strategies and tools at work. But also, I'm not perfect. I'm not getting up at 4 a.m. and doing an ice bath and meditating for 2 hours. No, this is not one of those bro CEO, here's what you have to do to be successful. This is a video where I'm going to share some concrete tools and how to use them that can really help you working in the context of public health, where we have demanding workloads and high turnover and not a lot of funding. These tools are practical and you can use them in your day-to-day life. They are not unrealistic, they are simple and they are effective, and they will work for you. So let's jump in. Tool number 1 has to do with your email. Email itself is a system, it is a tool, but I want to talk about a specific way to use it. So I follow a process called Inbox Zero. I teach this to the clients in my coaching program. In this video, we're not going to necessarily talk about Inbox Zero. That's a whole system itself, and that's not right for everyone. It's not the right system for everyone. It's not one size fits all. However, I do want to teach you a step from my Inbox Zero process that I think is going to help you utilize your inbox to be more productive, more efficient, and more effective, even if you have thousands of emails unread. I see some of you. It's okay. So there are a couple things in the Inbox Zero system that I teach that I recommend you start playing around with and implementing. Number 1, your to-do list or your tasks should not live in your inbox as unread emails. That is not productive. That's not efficient. Take anything you need to do that you get an email about, an assignment, a task, and put it on your actual to-do list. Your inbox should not be your place where you have your to-dos listed in the form of unread emails. That just makes it cluttered and you lose stuff and you forget and you fall behind. Number 2, I highly encourage you to build the practice of only checking your emails 2 to 3 times a day. For most people in public health, the emails you get aren't life or death. They are not urgent. If it takes you an hour, if it takes you 3, if it takes you a day or 2, it's typically fine. But if you're checking your emails 2 to 3 times a day and you have set time for that, then you can still respond to emails, but not get distracted by your inbox and the rest of the day be focusing on the work you need to get done. Now, the other tip around emails, which I know you've heard, is turn your email notifications off. Again, I've worked with so many women in public health. All my coaching clients, all the thousands of hours I've coached in public health, I've only had only one public health client who truly needed her notifications on. And that's because she was in emergency response. She was technically on call and being paid to be available. I've worked with county health directors. I've worked with faculty members. I've worked with project officers at federal agencies. I've worked with so many different people in public health. The vast majority don't need email notifications turned on, especially on nights and weekends. Okay, so now we got some of those tips out of there. Here's the main one I want to share about Inbox Zero and about how to use your email to be more effective. I call this the 2-minute email processing tool. When you open an email, if there's something you need to do, maybe you need to respond to the email, maybe you need to send an attachment, maybe you need to review a draft. If you can get it done in 2 minutes or less, do it right then and there. If it's going to take you more than 2 minutes, take that and put it on your to-do list. This allows you to get through your email more efficiently and more effectively. Things won't fall through the cracks. You'll have fewer unread emails. You'll be more efficient and quicker at replying to emails. And your inbox no longer will be this black hole with a bunch of stuff missing in it. Now, even if you have 1,000 unread emails, you can do this process. You don't have to get to Inbox Zero to implement this processing rule. So I actually jammed in like 4 or 5 tips in that number 1 tool, okay? So you can go back, re-listen to that, practice it if you want. Tool number 2 is our calendar. If you are not, for heaven's sake, if you are not using a calendar, I don't care if it's paper, I don't care if it's electronic. If you are not using a calendar, you have got to start using a calendar to organize your time, to organize what you're doing. But here's the big tip with the tool of the calendar and how to use it so it's more efficient and you can be more productive. Stop using it just for your meetings. Start using your calendar to plan out when you're going to get various tasks and projects done, when you are going to work on various assignments. So this is often called time blocking. And you don't have to do the whole week time blocked out. Actually, in the course that I teach, I break it down so each week women in the course are learning how to do it bit by bit. We don't just implement it all at once because it is a system and a skill you want to build. But here's where you can start. At the beginning of the week, look at your to-do list and see, are there 1 to 3 priority things I need to get done this week? And then identify on your calendar open time that you can get those done. And I want you to actually block off that time on your calendar to do that activity, to do that task, whether it's drafting a manuscript, working on an outline, reviewing a performance review, responding to emails, whatever it may be, put it on your calendar so you know, okay, 1 o'clock on Tuesday, I'm working on this. And treat it like a meeting. Treat it like a dentist appointment. It's an appointment with yourself to get your work done. When you use your calendar to time block, you aren't guessing at what you should do when. It's already planned out for you. So you waste less time trying to make decisions or get stuck in indecision. You are quicker at moving task to task, and you're utilizing your time more efficiently. It also reduces decision fatigue. So much about productivity and the tools and systems we want to implement to be more productive is ultimately about reducing indecision and decision fatigue because that wastes so much time. Tip number 3, use AI as your productivity planner. Now listen, I know there's a lot of hesitation in public health about AI. Do we want AI to do complex public health analysis and assessment and policy without human review? Absolutely not. But AI can be such an effective tool to help you with your productivity, with being efficient, with getting things done quicker. So you can use a tool like ChatGPT, and I know there's many others like Gemini and other things, to help you draft emails. Rather than sitting there and thinking about what's the best way to say this or drafting something else and rewriting it, you can ask AI, hey, here's what I need to communicate. Can you draft an email? Of course, you still review it and you make edits, but it will save you so much time. You can have it help you format documents, review your writing for clarity, draft meeting agendas or summaries, create templates for you. There's so many things you can use AI to help you be more productive and efficient and basically do the tasks that if you had a human assistant, if you had a student assistant, if you had a office assistant that you might ask them to do. Hey, can you format this document? Can you check this for errors? Can you draft these emails? Can you create a template for this? Think of AI as that assistant that can help you do that. AI should never ever replace your expertise or anyone else in public health, but can help us speed up those organizational, those mundane, those tedious tasks that we do need to do in our work in public health. Tool number 4, maybe my most favorite, and I use a lot. It's a simple timer, okay? But I'm going to tell you how to use the timer. Some of you might think that I'm going to tell you about the Pomodoro method. I am not. I have mixed feelings about that method. We'll get into that in another video. I'm talking about the 10-minute timer method, and this is really effective for if you're struggling with procrastination, putting things off, getting distracted, not knowing where to start. Set a 10-minute timer. Tell yourself, okay, I'm just going to work on this for 10 minutes and physically set the timer. You can use your phone or something else. And when it goes off, let yourself take a break. For most of us, our brains think, okay, I can do 10 minutes. Especially if we physically set the timer, our brain believes us. Okay, it's only going to be 10 minutes. So that hesitation to do it, that resistance reduces and we can get started easily. And then listen, if that timer goes off and you feel like you're in the groove and you can keep going, keep going. This is one of the most effective tools to stop procrastinating and stop dragging our feet and get going on work so we can be more productive. Tool number 5. And maybe this is less of a tool and more of a strategy, but I include it anyways. Create some email templates. Again, you can use AI to help you with this, that you can just do a plug and play when you need to send emails. This can save you so much time to be out of your email inbox and to be getting other things done. So it can be follow-up meeting templates, project update templates. Let's say you're a project officer, you have a bunch of grantees. You can have a template to update them and just Plug in or change the things that are specific to their project. Boundary emails. If you know you need to respond to a lot of emails with, no, I can't do this, or please refer to someone else for this, or passing it along, create templates for that. Templates that give people information they've requested. Here's the information you requested templates. Templates asking someone to complete something. Here's my favorite, follow-up templates. We think it's inconsequential. We think it's so small. Oh, every time we respond to an email by saying, hey, following up on the last message. But you know what's quicker? Copy and paste that. Copy and paste that template, put it in there, send it away. You don't even have to think about it. Those things really add up. And the difference between someone who is hyper-productive and efficient and someone who is just average are those small moments, those small changes that we're making to shave off a second, 30 seconds, a minute of time that adds up over the day. And not just about time, about the mental energy, the mental bandwidth. Notice so many of these tips and tools aren't just about saving time. Using the email template, using AI as a productivity partner, processing our email, time blocking. It's ultimately about saving our mental emotional energy because we don't have to make as many decisions. We don't have to think through things as deeply. We don't have to revisit things a million times. We don't have to find things in our inbox or in our to-do list. It saves the mental load, which ultimately gives us more energy to be more focused, think at a higher level on the tasks we are actually working on, produce higher quality work. These tools are incredibly effective. Like I said, I teach these to women in my coaching program. I'm actually working on a whole course where I put all of the systems that I use in my business and for myself and that I teach my clients into one consolidated course. And the reason I'm doing this is because what I have found when women in my coaching program implement these changes, their productivity increases by 40%, y'all, 40%. Now listen, I'm going to be sharing a lot more videos in the coming months with other tips and strategies and tools for you to be more effective and efficient. Why is that important? Because we want more energy. We don't want to feel exhausted at the end of the day. We want more time. We want to be able to take our lunch, to finish work on time, to go work out, to have our weekends free from work. And productivity and being more efficient is one of the main ways we can create that for ourselves. So make sure you subscribe so you don't miss any of those upcoming videos. And before I go, what is the tip I didn't mention that you use to be productive? Let me know in the comments. I would love to crowdsource and share them out. The more tips we have, the more we can be more efficient and effective, the better public health as a field is, and the less overwhelmed you're going to be. All right, everyone. Bye.